Good evening. Before we start tonight's program, a reminder that this episode will address mental health and depression, which may be sensitive to some of our viewers. Viewer discretion is advised. We remind you to please consult your doctor, your mental health professional, your outreach group, your sponsor, or specialist before adopting any change to your dietary, physical, and/or mental health regime. If you're looking for options to go down with respect to mental health, contact SAMHSA, the Substance Abuse and Mental Health Services Administration, at 1-800-662-4357. The service is open 24/7, 365 days a year, and is a confidential, free information service for individuals and family members facing such stressors. Also, if you're feeling suicidal crisis or emotional distress and need to be put in touch with a crisis center, call the Suicide Prevention Lifeline at 1-800-273-TALK. That's 1-800-273-8255. Or go to suicidepreventionlifeline.org. You can also text the word HOME to 741-741. Again, HOME to 741-741. Those resources are also available 24 hours a day, 7 days a week, 365 days a year. And on that, let's begin. Tonight, we're going to continue the conversation about depression, and we're also going to give you an update on the Malnation story that I talked about on Tuesday, and the use of two words that I never thought I'd be using in my life, but we'll attack that straight on. We'll also talk to Ashley Blake, who is a clinical professional who's seen depression left, right, and sideways, to tell us more about what the ongoing trends are with depression, and moreover, how do you know if you're depressed? We'll talk about that and your questions and comments. This is The Venture Forward. Good evening, or good morning, or good afternoon, wherever you may be, and welcome. This is The Venture Forward. I am John Venturini. I am a recovering addict of overeating, alcoholism, and compulsive gambling. And over the last 4 months, we've talked about many versions of those three topics. But in the last couple weeks, last couple episodes, we've talked about more of things that have been holding me back. And as we talked about on Tuesday, there are things that are going on that basically have become something that has not been addressed in about 9.5, 10 years. We got more information on that. We're going to talk about that to start off tonight's program. But then we're also going to talk about depression. And we have a very, very great guest joining us this evening who's done the show before, in that of Ashley Blake. She has a lot of perspective on depression by the many clients that she sees, and also ways that you can find out that you may be battling some form of depression. So we'll talk about all of that in minutes, but let's see who's joined us here on YouTube and Facebook. And I'm also pleased to see that Facebook is working. So everybody's here tonight on YouTube, Facebook, and Twitch. And we'll start off with Jamie. How are you? Hope you're doing well. Good evening to you. Jane, good evening to you. Hope you're doing well. Sarah, great seeing you tonight. Hope you're doing well over in Philly. Marilyn, good afternoon to you. Hope you're having a great afternoon for sure. Hope you're having a great day too. I'm glad you're here for sure. One quick thing before I go to the next comment. I've been noticing my verbal crutches, so we're going to start keeping count of that. And I think it'll be like a dime for every verbal crutch I use, and we'll take up a collection. But I'm glad you're here. Had to address it. Of course I did. Matt, hey, how are you? Hope you're doing all right. Sarah, I've been thinking about you too, and I'm glad you're here. We'll talk about what's going on and what the update to that story is. Jamie says, so glad we're talking about depression. I feel like things are so hard for everyone right now, especially this time of year. We'll get into that. It's something that is basically the reason why we've decided to talk about this to start out season 2, and we'll get to that momentarily. Matt got to co-host his Thursday show, but he dropped a like. Or got co-host. So, catch us on replay. Glad you were able to just drop in and say hi. Vitamin D for the dark winters in Ireland really helps. You know, it's funny, and we talked about it on Tuesday. Vitamin D is definitely looked upon by many neurologists as far as what the brain does as far as treating against demyelination and multiple sclerosis. And we'll talk about that a bit more in a minute or two. High dose, it says on the packet. Yep. And I had a conversation with my neurologist this morning, and the first thing they said, it was him and his assistant, get vitamin D. You need to up your vitamin D. 5,000 IUs at least. So that's something that I know. I've been taking a lot of supplements and a lot of vitamins, but I haven't been taking a lot of vitamin D. So that's something that needs to definitely go up as far as what I take in on a given day. Another thing I've read is B12, and for that, I'm taking B12 in addition to the other supplements I'm taking as well. Sarah says, that sounds like fun until we start counting my verbal crutches. Yeah. You know, I've watched replays and I've noticed how many times I've said moreover and for sure. And it really, I got to get better about this. I got to get better with. But yeah, it's something we all gravitate to. Vitamin D is important since we no longer work outside. Yep. And Jamie says she needs to take vitamin D, honestly. Okay. So let's give you the update on what's going on with me and demyelination and the two words that I didn't think I was ever going to say. But I'm going to say them. And I'm going to say them right now. Hang on one second. Let me go over to my screen. Actually, let me go back here for a second because there was another comment. Vitamin D has to be the right kind of vitamin D in terms of metabolization absorption. Yes, absolutely. And we'll talk about that more in a little while. So, all right. So we're talking about depression, demyelination. The story continues with respect to that, but you wanted to know what the MRI looked like as far as my brain, and with the contrast and without contrast. Here's what it looks like. I got those images first thing Wednesday morning and had a conversation about that with my neurologist this morning. And it's the same thing that we kind of talked about on Tuesday, in the sense that there are lesions going on in my brain. If you see the sort of discoloration here, if you could see my mouse here, maybe you can, maybe you can't. You could see that there are white spots that have various different colors. Some are lighter white, some are darker white. And the thing is, that talks to, well, the lighter white is the new demyelination. It's the demyelination that's happened within the last 3 to 5 weeks. But the darker white is the demyelination I suffered back in 2011. So now you have two events that they have basically identified through those MRIs. There are more tests that have to be done. There's no question about that. But I think the neurologist I talked to this morning and also my PCP are saying the same two words. And those words are multiple sclerosis. That's what multiple sclerosis looks like, especially multiple sclerosis that is centered around the brain. So, what are the next steps? You've seen an MRI. You've seen an MRI with the demyelination. Well, I want to take a spine MRI. So to basically get another look at my spine, my spinal column, and see what that looks like to see if there are any lesions along there. Another lumbar puncture spinal tap will probably be in the cards as well. I did one 10 years ago when this first happened. There will probably be another one. And then the other thing they said to me this morning was continuous examination semi-annually for a while, which, if they're going to put me on medication for it, and there's at least 20 drugs now in the multiple sclerosis landscape that really are there to help and are a lot more effective, have a lot more efficacy than the crab drugs. We talk about Copaxone, Rebif, and Betasterin, and all of that. The drugs that are now there for multiple sclerosis is a lot better. So that story has distinctly changed. I'm going to go back to Maine here because I want to have a moment of honesty here. This whole thing has been really rough, for sure. There have been days in the last 3-4 weeks where I have not been myself. Has been really hard on me. And I have to take a moment out and thank a lot of you that are watching tonight. A lot of you who have basically offered me your thoughts and your prayers and your heart. Because to be actually putting the words around us and understanding what's going on, this has not been easy. It has not been easy whatsoever. And knowing that I have people that watch the Venture Forward but have become dear friends to me have been really helpful and really loving, and I love all of you greatly. So thank you. A couple of comments, and then we're going to talk to our guest, Ashley. Oh, that's a question for Sarah. What do you think? Does it depend on the person? And then Jamie says, it will go, hope those go well. It's scary. Yeah, it's very scary. The fact that here I was laying on an MRI table on Monday and just dealing with this and trying to stay still for 45 to 60 minutes and making sure to have a great sort of look at what's going on with my brain and whatnot. And then also waiting for what neurology has to say. It's been really taxing, but I guess the thing is, I feel optimistic. I feel really optimistic. And there's a course to this. There absolutely is. It's going to take a lot more work. It's going to take more Solu-Medrol, which I'm starting a high dose of that tomorrow because I still feel symptoms up here. And hopefully after some Solu-Medrol, I'm going to start feeling a little bit better, but then it's going to be a question of doing a disease-modifying treatment to try to figure out what's going on upstairs. On that, I've left my guest wait long enough. Let me get Ashley joining us here tonight. Ashley, how are you?
I'm good, John. How are you doing?
I've seen better days. It's been one day at a time, right? It's why I said to Facebook, one day at a time, one step at a time, one foot in front of the other. That's what this has been. So yeah, it's been a work in progress. I have to quickly thank you, Ashley, because You've helped me out a great deal in all of this, and I really, really appreciate your advice and your care in all of this. This has not been easy whatsoever, and I thank you. I thank you from the bottom of my heart. I do.
You're very welcome.
Depression. We started talking about depression on the Tuesday episode and how to figure out how someone's depressed and whatnot. Ashley, and I did it again. I did it on this. Ashley, do you want to introduce yourself briefly?
Sure. I mean, people have seen me on the show before, but for those of you who are new, I'm an outpatient therapist in central Pennsylvania. Um, my work includes mental health, drug and alcohol addiction, gambling addiction, and the treatment of sex disorders, including porn addiction and sexual offender treatment.
So you've seen depression a lot.
Yeah, every therapist has.
But I guess my question would be, how much has that picked up in the last, I say over the holidays, right? I would start from like November onward, but then also the wonder that 2020 gave us.
Sure. So COVID caused an increase in depression because of the increase in isolation amongst us all. Human beings are social creatures. Lack of socialization leads to depression symptoms. The holidays are always a stressful time, and we see an uptick in depression and unfortunately suicide as well during the holiday season. And then you get those sort of post-holiday blues. January starts the will spring ever get here sort of feeling, and combine that with the lack of sunlight, the low vitamin D levels for those of us in the Northeast, and it's just a recipe for depression.
And I guess between the weather that winter brings on, the late fall, winter, the winter months coming on, but also the isolation and all of that, and all these rules that we're dealing with right now. You pick your municipality and you're going with a different rule book every single time. I'm sure it's been very taxing with respect to families as well.
Most definitely. And I think with COVID, you have the issue within families of different family members treating the seriousness of it differently. So there's an increase in family tension, which can also cause an increase in depression and depression related symptoms.
Yeah. And I think, we talk about what we talked about previously on the show, and certainly there's a familial line to addiction that we've talked about with respect to the overeating, the alcoholism, the compulsive gambling, the codependency, co-addiction, but it kind of gets sort of amplified during the holiday season, no?
Most definitely, because you're bringing those stressors that go along with the holidays and being around family members, especially family members who may be a little more toxic in their relationships and by not using healthy boundaries. And then when you're looking at sort of the family lineage of things like addiction, there is a family lineage to mental health issues as well. So tends to be if you've got a first degree relative with depression, you have a higher likelihood of having depression. Same thing with anxiety, bipolar disorder, schizophrenia, etc.
Yeah, it's something that I know I see it with my familial lines, and I'm sure many do. I think a lot of people talk about depression and not understand exactly how you find out whether or not you're depressed. What's the sort of examination battery that's used for depression? I'm going to bring up the slides I showed from Tuesday real quick.
Mm-hmm.
There we go. So basically, it's a sort of thing where you're seeing people who are sad, having a depressed mood, loss of interest, trouble sleeping, and whatnot. Out of what else is in that list? Loss of energy, increased fatigue. What other sort of facets do you see that you've been seeing for sure with your various clients and whatnot?
You do tend to see anger actually increase, anger and irritability. And what becomes difficult as a clinician is trying to recognize, is that anger symptom a symptom of depression, or is there mania or hypomania going on where it's coming into play? But anger and irritability are actually fairly common symptoms of depression, especially in men.
Yeah.
Um,
I know with respect to, and again, I have never been properly diagnosed with depression, but I know through the events that I've experienced over the last 3 to 5 weeks, I noticed that those sort of triggers have been amplified a bit. And certainly there's a tie between demyelination and depression. We kind of hinted at it on Tuesday, but it happens. And as far as the irritability and that sort of up down up down up down, it happens a lot.
Oh, most definitely. And most autoimmune conditions, and multiple sclerosis is an autoimmune condition, actually have depression and anxiety as symptoms of the disease.
Hmm. I think, you know, and this may be more of a question for my neurologist or my PCP, but with respect to dealing with depression that's triggered by sort of a disorder like multiple sclerosis, demyelination, any sort of mental disorder, what's what's a sort of treatment plan there is for the depression that's different than when someone that doesn't have a diagnosed sort of mental health sort of disorder, what's that sort of difference in the treatment?
Well, it's not that different. The concern is really the severity of the depression. So, mild to moderate depression can be treated generally holistically without the use of medication. When you're looking at severe depression, um, so that would be like a PHQ number of 20 and above, medication is almost always recommended. We also have to look at how long things have been occurring. So the baseline for depression is the symptoms for 2 weeks. So if you've had severe symptoms for 2 weeks, you may not necessarily need medication. We may be able to bring this back using other treatment methods, such as cognitive behavioral therapy, dialectical behavioral therapy, exercise and diet modifications, sleep modifications, etc. But if you're somebody who's been having these severe symptoms for 10 years, which is not unheard of, then medication is probably going to be necessary just to get you to a level of stability for the therapy to work and alternative remedies to work as well.
I wanted to ask a quick question about that. And I know when I made that question to the neurologist this morning, I said, I have a controversial question I want to ask you. And I might as well just ask the question straight out here. But as far as treatment is concerned, what sort of role does things like, and again, this is under the guise of treatment of emotional mental health, what sort of treatment does CBD provide as far as the mental sort of aspect?
Okay, so when you're looking at CBD, CBD is the part of the hemp plant, the marijuana plant. Um, it focuses on calming the central nervous system. Um, so if you think of something like Ativan or Xanax, that calms the central nervous system as well, but is highly addictive. CBD is not addictive,
Mm-hmm.
as far as studies have shown so far. We have to remember that CBD and THC are different chemical components of the marijuana plant or the hemp plant. Depends which way you want to discuss it. But CBD has been shown to calm the central nervous system and also decrease inflammation in the body. And there have been studies that show that increased inflammation can also be part of a depression diagnosis, as well as as a diagnosis of multiple sclerosis and other autoimmune disorders.
Hmm. Of the other autoimmune disorders that are out there, how much of a dependency or how much is depression a big player in the other autoimmunes? I mean, I know of a slew of different autoimmunes, but as far as what you have seen.
I have found that, most of my clients who have autoimmune disorders will forever meet the criteria for depression in some capacity. When we're looking at autoimmune disorders, we're discussing things like pain issues, joint issues, the chronic need for treatment, having to change lifestyles drastically. Low energy is a common thing. Low energy is also a common symptom of depression. So they start to go hand in hand, which is why depression is often a symptom of autoimmune disorders.
It's something where I know of various people in my life who've had autoimmune disorders ranging from psoriasis to other disorders. And I'm just, not that I think we know the number, but how much that sort of depression is basically tied to those that suffer from that. It's interesting to see the more and more they figure out about disorders that people deal with, whether it is things like multiple sclerosis or psoriasis or what have you, how much there is a tie between the disorder itself through inflammation and then also the mind.
Oh, most definitely. The more research we're getting about inflammation, especially, it's really showing that connection between the autoimmune disorders and depression.
As far as figuring out and going through the battery of the depression questionnaire, so you mentioned the PHQ before, but then there's the Beck depression inventory. What sort of inventory works for clinicians like yourself?
Most of us will use the PHQ-9 as a basic baseline. And then all of us kind of have our own sort of trickery, if you will, that we use. It may not be an exact Beck, inventory or a Hamilton inventory, but it's kind of a hodgepodge of them, really. I use the PHQ-9 to give me a baseline of minimal, moderate, and severe. But then I start to gauge other quality of life issues to really ascertain a full diagnosis.
The questions or the items on the right hand side certainly just a sampling of the different items that you go through in the PHQ, but also the BDI as well. No.
Well, yeah, the PHQ, the perk of the PHQ is it's really short. It's 9 questions plus a 10th one that just asks how difficult has this been for you. When you look at the BDI, it gets very specific into things. I use parts of it to ask kind of questions like, have you been feeling agitated? What triggers the agitation? Because I feel knowing the triggers is actually the more important thing, and to know if it's a constant, if it's an identifiable trigger, or if it's out of nowhere.
Yeah. There's some questions that are popping up. I'll go back to main screen here. And thank you, by the way, for that. I appreciate that. See, there we go. It's us again. So let's go to some questions. A couple questions popped up. Sarah asks, how often is depression an underlying factor in addiction?
Quite often, actually. It can also be a factor in withdrawal as well. So there are plenty of people who self-medicate. There's no great studies on this, but it's 30 to 50% tends to be from those who say they're self-medicating. But it's also a common thing in the withdrawal process and in post-acute withdrawal symptoms for depression to come into play because of the changes in the brain to dopamine, serotonin, and norepinephrine.
Quick comment from Jamie, if it will pop up. Addiction runs in my family, but I am not too sure about depression. I have chronic depression, so maybe.
Could it? Possibly. We also have to consider the fact that in most families, we don't talk about mental health. Some of us might have the crazy aunt or something, and that's about it. We don't really talk about mental health in our families when we really should.
Jamie continues to say, I forgot that pause can last for quite some time.
Yeah, pause can last up to 2 years.
And then there was one other comment. Oh, from Jamie again. We definitely didn't talk about it in my family growing up.
Most families don't. You know, I am a therapist. We didn't talk about mental health in my family. Me becoming a therapist has kind of opened up those doors a little bit in terms of people talking about it. But even still, I get family members who think what I do is just weird because they don't even believe in mental health.
Do you find that to be basically a generational? This is probably the obvious gimme softball question, but in your eyes, do you find it to be generational as people would seem it to be, or are there other factors?
I think a lot of it is generational. It also depends too, I think, on socioeconomic status, as odd as that may sound. Um, People from wealthier families tend to have better access to medical care, and that includes mental health care. So
Mhm.
then there's a greater discussion about mental health.
Uh, Jamie says going to therapy. Bring it up, John. Come on, you can. There we go. Going to therapy has opened the door to talking about it. Sorry for blowing up the live chat, guys. Haha. Jamie, this is your place to ask questions. Your questions and comments. I appreciate the question for sure. And therapy, as I alluded to in on the first episode of Venture Forward, is you got to figure out what's going on upstairs in order to fix anything that's going on with you. Whether it's a question of weight, whether it's a question of alcoholism, whether it's a question of compulsive gambling, question of drugs, yada, yada, yada. You have to look at what's up here before you can start treating everything else. Sandy says, hi, JV. Hi, Sandy. How are you? And Paul, the man of the many different hair colors, says, thank you for sharing all this information. Thanks, Doc. There was one other thing that I wanted to bring up real quick before we continue. And that's Alan. Alan, a dear friend of the community here. Alan, a dear friend of me, too. 6 years of sobriety last Monday, Alan. Congratulations, man. Appreciate it. Proud of you. Keep on doing the darn thing, the right thing. One step at a time, one foot in front of the other. Keep on doing it for sure. And I think there was one other thing. There was one other thing, and I just can't. Oh, here it is. Thank you for being so open with us and not just nothing. It is going back to the MS. Yeah, that's. The thing is, we have to talk about it because I am led to believe, outside of the numbers that you'll see, I believe a lot more people deal with demyelination. And if we can talk about this and have open and honest conversations about demyelination and multiple sclerosis, yada, 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 it's important, right? It's everything to do with up here, but what do we just say? In order to treat the other things that we deal with, we have to figure out what's going on up here before we could do anything about that. So thank you, Jamie, for saying that. Thank you, Sarah, for saying that for sure. And then Sarah congratulating Alan on the 6 years of sobriety. I guess one of the questions I have for you, Ashley, and this is sort of almost like not necessarily a generational question, but an age question, is what are the sort of things that you see with younger patients, younger clients, that you see also with the older patients and older clients that people may not know about? People may not think, oh my God, that affects kids as well as adults. What do you find?
Um, with depression, you will find kids losing enjoyment in activities and in toys. So you can see depression in really little kids, even when you start noticing that they're not playing with their toys the way they normally would.
Are there
That's a big
certain
one.
Yeah, are there certain exercises, obviously, with some of your clients, your patients, you obviously do toy play with them, and you play that sort of
Play therapy, John. It's called play
play
therapy.
therapy.
Yes.
It's been a long week, Ashley. I'm sorry. Play therapy, yes. Is that
Yes.
something that you could find use for your adults as well? Adults that are coming in that may need an outlet to color.
Yeah, actually, I use coloring with everybody of all ages. Coloring is something that allows people to not focus on me as much, which can help them to open up. With my little kids, I sit there and I color with them. And we just talk in color. And with my teenagers, I bust out coloring books and they laugh at me, but they end up enjoying it. And I have plenty of adults who color throughout their session. I've grown quite a collection in my office of pictures done by clients, but it does allow them to open up better. And it's a tool that really does span all ages.
It's amazing how much you could find out about the person who's drawing in what they draw, and it's just mind blowing how much you could pick up on certain nuances, certain things.
Well, yeah, I do drawings with kids, especially. That really helps me understand family dynamics a lot when I ask kids to draw their family. Um, I I even do little things like with adults, noticing the colors they choose. Um, I have found that when people are really struggling deep with their depression, if they're really sad, their color choices tend to reflect it.
So when they go to the darker colors, I'm assuming.
Yeah, so you might have a picture that, from the looks of it, you would think would be something cheery, flowers, butterflies, whatever, and then you notice these darker tones being used.
I guess the other thing that's fresh in my mind asking you this is we talk about things like the PHQ and doing that to figure out what sort of degree of depression there is. How do you, outside of drawing and play therapy, how do you gauge that with kids?
Um, with kids, it's all about being able to get them to talk about things. So if I can get them to talk about friends, and they might tell me that, they're not sitting with any of their friends at lunch anymore, or, asking them, why'd you quit soccer? And gauging it that way. Um, I will say that, especially with teenagers, their peers are their biggest influence. So if you find that they're not engaging with their peers, that is definitely a sign that something is off.
Mm-hmm. So that's a behavior that you can find even with your adult clients, in the sense that, hey, this is someone who doesn't participate in groups anymore, doesn't participate in organizations, doesn't hang out with their friends. That's a telltale sign that there's something amiss.
Exactly, exactly. So when you see that change in socialization behavior, also if you have somebody who always seemed very extroverted, suddenly they're very introverted, vice versa, too. There are people with depression who may have always seemed introverted that now suddenly seem very extroverted, and
Mm.
it's basically they're putting on a show to hide their depression.
The marriage between introversion and extroversion, I've heard it called ambiversion or panversion.
Mhm.
How real is that?
Well, we got to think of extroversion and introversion on a continuum,
Mm-hmm.
right? Nobody's 100% introverted or 100% extroverted. You do have those people who, like they say, the extroverted introvert and the introverted extrovert. So you have people who enjoy socializing but tend to be quieter. That would be your introverted extrovert. And your extroverted introvert would be somebody, honestly, like me, who I do therapy all day long. So I'm talking and engaging with people all day long. And then I'm completely exhausted from talking and engaging with people all day long.
Introvert, extrovert versus the extroverted introvert. That's that makes a lot more sense than saying someone's an ambivert. I hear
I
people
don't like that
call.
term.
I don't like it either. It's like I've taken an MBTI exam and I'm an ambivert. Really? Did you answer all the questions? Anyhow, I guess the other question, and you mentioned this before. I figured I ask you more about that. The PHQ rating scale. What sort of so first walk us through exactly the 4-point Likert scale that goes with PHQ, but then moreover, what sort of levels are depression and severe depression and whatnot?
Okay, so the questions of the PHQ 9, we ask, so in the last 2 weeks, have you been feeling down, depressed, or hopeless? And it can be, you know, several days, more than half days, nearly every day, or none at all.
Mm-hmm.
And we use that scale going downwards through the different options, all the way down to suicidal ideation, suicidal behavior. And then we're looking at mild, moderate, and severe. So once you get above 5, that puts you in the mild. Moderate starts around 10, 11, 12, depends who you ask. Severe starts between 15 and 20, depending on who you ask. Because the PHQ-9 is not perfect, it's not infallible. You need other measures that you're doing through, asking questions to really get a solid answer for a diagnosis. But it's a starting point so that we can look at, is this, major depressive disorder mild, major depressive disorder moderate, major depressive disorder severe with or without psychotic features, and moving onwards from there.
I assume with some of the cases that you see, because not only do you do regular clinical stuff, but there's also court-ordered therapy or court-ordered sessions that you do as well. I assume that with the ones that are court-ordered, those numbers kind of scale higher, no?
Actually, it's the opposite, because those who are court ordered want to get done with therapy as soon as possible. So they tend to not tell the truth in the beginning, at least. Once you get them talking and comfortable with you, you kind of get the real answer. So a lot of times those people start out with just, affective disorder undetermined as a diagnosis until I can get them to be honest.
That's again, I'm going with a major misconception, and you basically shot that out. It's awesome. Thank you. Appreciate that. I guess my last question for you is, with respect to depression and where we are as a society, trying to better treat depression and better promote mental health or whatnot. What are some of the things that you've been seeing that help out with that, and moreover the initiatives and interventions that your practices have been doing as far
Sure.
as that?
So outside of medication, when it comes to therapy, looking at things like CBT, DBT, acceptance commitment therapy, addressing attachment issues, and family structures as well. But even beyond that, there's a lot of things that we could all do to help improve those symptoms in us and prevent depression too. One is getting outside every day for a little bit, any little bit. I tell a lot of my clients, I always ask them, do you drink coffee first thing in the morning? Okay, you're going to drink coffee on your front porch first thing in the morning every day. Because it's guaranteeing you're getting outside, getting some fresh air and some morning sunlight, which can really help with melatonin production in the body, which our heavy use of screens actually interferes with, which in turn inhibits sleep, which is also a symptom of depression.
There is one person that is in this group that knows a thing or two about sleep. I'll just bring her name up real quickly. Christina, good evening to you. Christina is a sleep expert. She is a profound sleep expert. Would love to have you on the show at some point to talk about that, because the sort of connections, the intercorrelations between sleep and mental health are becoming so much and so evident, especially to someone in my age group in the 40s, but I mean, all over the place.
Sleep is a big one, and sleep is something that most of us can improve upon.
I bring up a couple more comments here as we were talking. Ob, how are you? Good morning to you. Sue, glad to see you. Congratulations to Alan's 6 years of sobriety. And then a lot of back and forth over there for sure. Any final thoughts, Ashley, about depression and moreover, what does sort of how does 2021 look like with respect to depression and what we could do to fix that?
Well, we can not use social media as much because it is a big stressor. That's a big one. I think with 2021, we need to look at how do we start renormalizing our lives now that the COVID vaccine is a thing and that there's a possibility for going back to what normal was. Yes, normal. I tend to say normal is just the setting on the washing machine, but we'll use normal for lack of a better term. But I think all of us need to take a look at ourselves and take a look at what can we be doing better to take care of ourselves, and in turn, what can we be doing better to take care of our loved ones. And sometimes that is as simple as asking, how are you? And when they say fine, you say, no, really, how are you?
Throwing the BS, the Bravo Sierra at them when nothing is that's not true, and I want to know more information, and you tell me exactly what's going on.
Exactly.
Did I clean that up? Not that I'm rated for profane language or anything, but anyhow.
I think you got the point across.
Yeah, thanks. Ob has another comment. I've done TDK and looked at myself honestly, and I dropped the pills and worked out my issues. I don't suggest that is for everyone. And then he goes on and asks, do you know about the Dunning-Kruger effect?
Not a huge deal on that one. See, there are so many things in the field of psychology that if we were to know all of them, we'd go insane. I mean, did I come across it? Of course, but it's not something that I necessarily engage in my own practice.
You mentioned terms like CBT before and other therapeutic methods. Do you want to quickly talk about the differences between those? I mean, high level?
Sure. Cognitive behavioral therapy, that seems to be the one most of us are familiar with. It's the idea that if you change thoughts, you change behaviors. If you change behaviors, you change thoughts. Dialectical behavioral therapy, first designed for people with borderline personality disorder, has been shown to have a lot of efficacy with individuals with addiction. It tends to focus more on how you can cope in the moment with distressing situations and distressful emotions. So a common thing with individuals with borderline personality disorder is that they jump to suicide as an answer to everything. Like, I had a bad day, I'm going to kill myself. This person looked at me funny, I'm going to kill myself. So it's about being able to sit in distressing situations. It also tends to be very helpful for those dealing with post-acute withdrawal symptoms, because that is a very uncomfortable feeling. Acceptance commitment therapy focuses on this idea of you can accept what life is for what it is, and you can make the choice to change or not change. Mm-hmm. And there are numerous other theories and other things out there. I do a lot of stuff with attachment theory, kind of the basis of how depression and anxiety manifests itself in our ability to relate with others, looking at things like anxious attachment and avoidant attachment.
Mm-hmm. I moved our names out of the way real quick so I could basically talk about the phone numbers I talked about in the beginning again. Mm-hmm. Basically, the use of the Substance Abuse and Mental Health Services Administration and the Suicide Prevention Lifeline. I assume these are numbers that you tell your clients and the people that see you.
Of course I do. I actually have them on a bulletin board on in my office, and I make everybody take a picture of it.
Yeah, and again, those numbers 1-800-662-4357 or SAMHSA.gov, but also 1-800 for the suicidal sort of ideation and whatnot that's going on, 1-800-273-8255, suicidepreventionlifeline.org, or you could text the word home to 741-741. And then one other, Leah, good evening. How are you? Joining late, but very interesting tonight. Good to see you tonight, Leah, for sure. And Sarah says, things that help us increase our tolerance for discomfort and ambiguity are worthy practices.
I wholeheartedly agree. And it's something that most of us have gotten out of the habit of being able to do, which is sitting in uncomfortability.
Yeah, I think the more that I know for me, the moment I started meditating, and then we're going now back 2 years ago, right? The quicker things like that started to subside. It doesn't subside completely, but at least it gives me a mechanism to have that sort of output, that sort of, I'm going to go to that visualization of sitting on a park bench or an airport bench and just stare at traffic and have just basically no thought. Just sit there and just reset.
It's a form of mindfulness. Mindfulness actually is the root of dialectical behavioral therapy.
Is there any sort of, not to put you on the spot, but is there any sort of meditation that you suggest to your clients?
That depends on your capacity to handle meditation, and the type of meditation you're willing to do. Some people, direct silence is great for them. Others need guided meditation. Some people need music. I've also, with a client who had ADHD but really wanted to meditate, developed a walking meditation for them to do. So that allowed their bodies to keep moving while they were trying to clear their mind.
And Sarah says meditation definitely helps. So there are a lot of folks that once they realize the importance of meditation, understand its necessity, John, necessity in their life, as far as getting that reset, that sort of mind balance for sure. I think as far as depression, it's something that we all see, especially what I'm seeing lately because of the events that I've been dealing with. But it's something that's always been there to a certain degree, and I see it increasing over time. Unless, I take care of myself from that sort of perspective, but it's something we all have to keep an eye on. Ob has a quick question. He calls it a silly question. Is there a way out of clinical depression if I work out my problems?
Yes. It's that simple. Yes. I have clients who've worked through everything, who successfully discharged from seeing me, who aren't on medication anymore. It is possible. We just have to remember that with mental health, there's no quick fixes.
Ob is not a professional, but about knowing about depression, but is interested in learning. So definitely more conversation that can be had there for sure. And he says, thank you. Sarah also says, thanks for explaining how many varieties of meditation there are. I think some people hear the word and get turned off.
Oh, most definitely, especially those people who think meditation is just sitting in silence, because sometimes that silence is deafening. One of my dearest friends and colleagues, his meditation is when he's fishing, and he goes fishing 3 or 4 times a week at a pond near his house. That's how he meditates, is through the process of fishing.
Is there any kind of fish that he's fishing for? Is there kinds of fish that are better meditative quality fish versus others?
I can ask him if they're real, if it matters what type of fish it is.
I used to live in New York City. It was flounder. I would go fishing for flounder in Bayside, Queens, and there's something really really cathartic about that for sure. Leah says, I have needed to find a new therapist for months, but avoided it out of fear. Any advice on how to overcome that?
So you need to take a look at what your fear is really based in. Is your fear opening up to someone else, or is your fear having a bad experience with another therapist? Because when you get honest about what the root of the fear is, you can actually address that with the therapist. I had a client one time that she was adamant that she would hate me, never get along with me, and this would be terrible because I was a woman and she hated dealing with women. And she'll tell you now that she was wrong. She had to, and we have this great therapeutic relationship. I don't mind being told that. Most of us don't. It's okay to be honest about that and acknowledge what your fear is.
How's it go? The truth will set you free.
Exactly, exactly. And you're not going to hurt your therapist's feelings.
No, and the thing is, the more transparency we have, the better off we are, right? It's basically whittling the artificial BS that we would put in front of ourselves because we're afraid. But the quicker that we remove it and we just deal with it straight on, the better off we are. Jamie says, silence can be the loudest thing in the world to me.
It can be for a lot of people. When you're in that silence, it seems like the thoughts just come rushing in to fill the void. That's why a lot of people need music or a guided meditation to be able to meditate.
I think the app that I use, I mentioned it in the beginning of the Venture Forward, is basically Headspace. It's something that you can use the app. There's a lot of free ways of getting Headspace now. They have a great YouTube channel where you can see a lot of the Headspace videos, but those 3, 5, 10, 20-minute sessions have been so important for me. And as soon as I recommend that to others, they start watching it and they say, thank you for recommending that. That has meant so much to me. So it's something that I proudly endorse for sure.
I agree with you. I use Headspace as well. I have colleagues who use the Calm app, and some that use Aura. All get good reviews.
Jamie also use Waking Up too, with Headspace and others. There's a lot of these sort of meditation services to have like built-in natural alarm clocks, to have gradual music, gradual sounds that wake you up in the morning. It's something so empowering about that, but gives you a chance for a really great day for sure. Aubrey has another comment here who says, I'm not against medication. For me, I did my own experiment by facing myself, and I had become brutally honest about my underlying problems. I dug deep, and today I am set free by the bondage of self.
Yeah, you did a lot of hard work. That's really what you did, a lot of hard work.
He didn't want to sit in that darkness. He either gets better or dies.
Yeah. You made that conscious decision, and even though you did most of this on your own, you were basically engaging in self-therapy.
Yeah, and the thing is, not to tie it back for a second, but it was that 480-pound guy who was barely able to walk more than 5 to 10 steps at RDU that says either I improve this or I'm going to die. There are a lot of people that hit that bottom and then they have to come to that sort of realization that they have to do something about it or they're going to perish. Anyhow, that said, Ashley, thank you. You provided a lot of insight tonight on depression, but I also want to quickly add something else in the sense that about what's been going on up here and the demyelination and the multiple sclerosis, and I wanted to thank you publicly for all you've done to help me out with that. This has not been an easy journey, to say the least, and your friendship and your care has been, and your love have been incredible to me, and I can't thank you enough, Ashley.
You're welcome.
Any final comments, Ashley?
Take care of yourselves, and if you think you are struggling or know somebody who is struggling, contact those resources that John has discussed. And I highly recommend everybody keep the phone number to their local crisis line just in their phones, because you never know when you need it or someone else will.
1-800-662-4357, samhsa.gov, or for the severe cases, for the suicidal ideations, 1-800-273-8255, the suicidepreventionlifeline.org, or you could text the word home to 741-741. Ashley, as always, thank you for doing the show tonight. You are in exclusive company. You've now done the show twice. So thank you for joining the Two Timers Club. And maybe there'll be a third and a fourth and a fifth, but you've been fantastic, and I appreciate it big time.
It was my pleasure to be here tonight, John.
Have a great night, Ashley. Thank you. Ashley. Incredible source of knowledge there, and deals with this stuff a lot. So if there was any person that can talk about depression and those sort of underlying factors to depression, it's Ashley. And we will certainly be talking about that a bit more. We will do another episode on depression on Tuesday. We have a third part. And on that episode, we're going to tie that back to the addictions we know. We're going to go into a little more at length as far as what that sort of marriage of depression and addiction actually is. So that's coming up on Tuesday. Coming up tomorrow, the show you know, the show you love, VF Talks is back with a certain cantankerous Triceratops who thinks he's a T-Rex, who will always have a thing or two to say, and most of it I can't air on a live stream. But we'll do that tomorrow night, 5:15 Eastern, 2:15 Pacific. And on that, I will always tell you, as I say at the end of every Venture Forward, stay safe, stay sane, stay strong, stay sober. You're worth it. I'll see you tomorrow night at 5:15 Eastern, 2:15 Pacific. Good night.